Hey all, welcome to the debut, the inaugural, oddly successful podcast, which is a podcast that celebrates people who followed their instincts, went against the grain, and ultimately found success outside of the traditional 9 to 5. I'm your host, Alexander Lafredo Dietrich, and before we begin, I'd like to just drop a quick little tidbit that you can find our episodes on YouTube and Instagram just by following at Oddly Successful. So with that said, in today's episode, we are interviewing Dr. Josh Morris, who is the CEO and co-founder of Ziplitics, which is a research services company based here in RVA. So after earning his doctorate in pharmaceutical sciences, Dr. Morris has built an explainable AI, which I actually want to get into what that means in a second, but has built explainable AI platforms for a variety of drug discovery and healthcare research applications. So let's start there, Josh. For the people who are not familiar with AI in general, but like explainable AI. What's explainable AI versus, I guess, not explainable AI? Is there a difference or something on the opposite end of that spectrum?
Well, I'm glad you asked. First of all, thank you for having me again, AJ. So explainability, it's a pretty important concept, and it's going to become a very important one relatively soon. And that's because the United States government is currently looking over legislation. It's in the proposal stages right now, but it will probably be passed within the next couple of years. That's going to require AI applications to be explainable, at least at the federal level. And as we kind of see with regulation and regulatory bodies, anytime something occurs at a national level, it really does start to trickle down into state and local legislatures. So,
Yeah.
California right now is actually creating their own AI Act. And even though they don't mention explainability in that law, there's
Mhm.
some hints to it that it's going to be required to be a part of practice, a part of the AI product. So
So real.
explainability.
Okay. Yeah, that's what I was gonna ask. Is what is explainability?
Explainability is, quite frankly, the ability for the algorithm to explain why it's making the decisions that it's made.
Okay.
So a black box is basically an AI or machine learning model that doesn't tell you the parameters that it used to make its decisions, meaning that it doesn't tell you how it's made its decisions, how it's
Gotcha.
taken the data and transformed the data and extracted those features from the data set that helped it make those decisions to include a study or exclude a certain patient characteristic, or how it used those values to predict a clinical value, like a
Mm-hmm.
person's healing rate or likelihood to have hospitalization or something to that effect.
Yeah.
So, um, explainability is very important because if the end user doesn't understand what's going on behind the scenes, behind the curtain, how can you really trust the results, right?
Yeah. I mean that's to kind of to bring it to like a non AI experts level. It's I mean, I assume most people here have gotten to eighth grade, and I remember like on homework, the teacher would be, "Hey, tell me why Christopher Columbus sailed, or what year did Christopher Columbus sail the United States, and why did he do it?" Or something like that. Like there's always like explain your answer. That's kind of
So your work.
yeah, but
Yeah.
yeah. Show your work exactly. Show your work, and so like explainability is essentially hey, you can't just throw down a random answer and not tell us why because who knows where it's coming from. And it sounds like, you're ahead of the curve on that already. So you're future proofing that, which is incredible. Are most AIs, are they explainable, or is this like people are, now that you have all this technology, AI technology that's coming out, you have technology that hits the market, and then legislation is kind of behind to catch up when they see how it's affecting the market. Is it more like that, where it's like hey, no one's really explaining it, and we need people to explain this.
It's very much so regulators kind of catching up with the curve. Like the field industry has moved so much faster than they've been able to move, and they're still trying to understand exactly what needs to be written in these laws. So explainability, it's not present in a majority of AI applications. As a matter of fact, most people will they'll try to sell you that their algorithm is explainable just because it lists a couple of references for whatever answer it generated. But the problem is with ChatGPT, for example, most of the time when you click on those references, it's totally irrelevant to the actual answer or
Yeah,
question that
yeah.
you were trying to answer. So explainability, again, what it really means is that it's the algorithm showing you its like inner machinations in a sense, right? Like it's
Mhm.
telling you in human terms, like you can read it and understand it, but it's telling you why it's made the decisions that it's made, not just giving you some studies and being like, well,
Mhm.
here you go, you can read this to understand why I've done this, but that's not really telling you the why. It's just it's a trick, honestly, that a lot of engineers have done to try to basically make it seem like their application is trustworthy
Mm.
when it's not.
Mm.
And something that I've been kind of pulling my hair out as of late is the fact that there have been a lot of algorithms that have
Mm.
recently come out in my space that are quite literally just API calls, meaning that it's just making like an internet connection
Yeah.
call
Yeah.
to ChatGPT or to Mixtral or to these other open, some open source, others like closed source, but with an API access model. And all it's doing is feeding data to these models and having those models then generate an output. And that's to me that's horrifying
Yeah.
because these models are trained on the internet, and the internet's not the most reliable source for information.
Well, and again, like I'm not the most technical person when it comes to this, but it sounds like, and again, let me know if I'm off the mark, because I want to put it into context maybe for people who may not have that technical background. But essentially, what those API calls are doing is it's just doing the getting a user to chat GPT for them. So like, I guess what I mean by that is, we type in chatgpt.com, it brings us to that website, which we can interact with that model. Really, all the APIs are doing, it sounds like, it's like, let's say you land onto, I don't know, this AI technology, we'll say about food, right? AIfood.com, and you
Mhm.
ask AIfood.com, all it's doing is just taking the question that you're asking and putting that into ChatGPT for you and then pushing it back. Is that kind of what's happening?
Exactly. That's what's
Gotcha.
happening. And they put on a pretty face, like they'll have some nice user interfaces built around this.
Yeah.
But the truth of the matter is that their core business model and product is based off of something entirely unknown to them and something entirely out of their control. Something I like to do for everyone listening.
Yeah.
Anytime ChatGPT goes down, look at ChatGPT's status, right, for OpenAI.
Yeah.
And anytime that goes down, you should then go to your favorite, chatbot-esque website
Yeah.
and ask it questions there and see if it's able to actually produce an output. Because if it can't, then you know what their secret sauce really
It's
is.
just tied together. Wow.
Yeah,
Okay. Wow. That's kind of that's slick.
yeah.
um, and wow. Okay. So it sounds like it sounds like you have a, I'll say, like a moral, an ethical bar of standards. There you go. You have a bar of standards that you have with Ziplitics, and I doubt we can get into like the inner workings as to how it doesn't do what we just talked about, because that's obviously like that's going to be proprietary information. Um, but one of the questions I have is, what drove you? I mean, if it sounds like people can just kind of hook up in an API and call it a day, what drove you to build this thing? Like, I mean, there's more to it. It sounds like you had like some drive in there to make this thing.
So my story is that I originally, when I did my PhD, I was originally being trained to be an analytical chemist. So
Okay.
essentially, what I was supposed to do was I was supposed to play with chemicals all day and work with these really big, expensive machines,
Yeah.
and from that, be able to tell patients whether or not a drug is helping them get healthier or
Mm-hmm.
not. And that was what my dissertation was going to focus on. And more specifically, it was going to focus on trying to develop biomarkers for this drug that was being repurposed to manage heart failure. It's
Mm-hmm.
called anakinra for anyone interested.
Okay.
But
Anakindra. Okay.
so initially, that was going to be my primary focus for my dissertation, and towards the end too, it was still the main project that I did. However, there were a lot of analytical steps and other studies that were kind of built around this heart failure idea that unfortunately were delayed as a result of COVID.
Mm.
So essentially, I was faced with this crossroads where I could either prolong my PhD for an additional 2 or 4 or however many years it was at that
Mm-hmm.
point, because I started my PhD in 2019, COVID hit,
Yep.
everything kind of went down, right?
Yeah.
So I could either have done that, which to me just sounded like unnecessary misery.
I've heard PhDs are not the most fun thing in the world to go after.
Mine was very tough. So it was, yeah, it I could have done that
Yeah.
and probably lost all of my hair, or I could save what little hair I had left.
You look good. You look good, man.
You know, I used to have this big massive fro, man, but it's I tell you, grad school does it to you, man. But I decided to go down the other route, which
Yeah.
was I need to pivot and become a computational chemist. So
Mm.
instead of working with chemicals and machines all day, I was going to work with numerical values and basically data spreadsheets and what have you, to try to understand how specific drugs are
Yep.
affecting patients in that capacity.
Mm-hmm.
Totally different though, right? So my initial training before grad school was kind of all over the place, but I was really interested in biology. So I had more biochemistry.
Yeah.
And with this pivot, to save my PhD, I had to learn a lot very fast.
Yeah.
So, and the caveat to that too is when you're doing grad school, like a doctoral program, you have a committee of experts who are
Mm-hmm.
going to call you out on your BS. They know when you're BS,
Yeah.
and they're going to make you do your homework.
Mm-hmm.
So when I went before them and presented my results to the minutia, like to quite literally a single line on a PowerPoint slide, they
Mm-hmm.
would point at that and say, "Is that a double bond? What does that actually mean right there in that lipid structure?" I would have to
Mm-hmm.
that is the level of granularity in my explanations I had to be able to provide.
Yeah.
And so part of this again was the necessity of getting to an answer very fast.
Mm-hmm.
But then the other part of it was I needed to make sure that the answer was actually correct. Because if it wasn't, then I was probably going to be forced to go down the other route and lose all my hair. And I didn't want to do
Yeah.
that.
Yeah. Yeah. Yeah.
So I I was a little bit of a hobbyist. I would play with computer code on the side, and I've always been a gamer. So, you know, internet netizen, that type of person, like that's where I kind of come from. But while I was doing my PhD, I was also developing this basic NLP tool on the side.
Mm-hmm.
The reason for that is because, I just thought it'd be cool if I could organize papers and read papers in a much more efficient fashion.
Mm-hmm.
So it started out as very basic natural language processing, but over time it has become this explainable AI framework, and I call it the Literature Review Network. That is our core product. And not only did it did it save my PhD in the end,
You are Dr. Josh now,
now I'm Dr. Josh.
with a head of
Uh,
hair.
there's a with a few pieces of hair I have remaining, yeah, strands I have remaining, but it saved my PhD.
Yeah.
And on top of that, now it's being used by researchers in research universities like hospital university systems, as well as pharmaceutical and medical device companies to actually conduct research. So I'm proud of what this has become because it was a tool that was created out of necessity. Necessity is the mother of invention, they say, right?
Mm-hmm.
Um,
100%.
and now it's become something even more. So
Yeah.
we're seeing all these AI companies come out that claim to be this panacea, this cure-all for healthcare.
Mm-hmm.
And it scares the living hell out of me, honestly, because if they can't even tell you, again, what the model is doing to the data, if they, in a similar fashion to what my committee did to me, if I would turn around and do that to them and they can't actually justify their answer, and you've got
Mm.
to realize that you're giving that
Yeah.
to clinicians and you're having patients be treated based off of those results that you yourself can't
Mm.
even justify. And that's horrifying to me
Yeah.
because that's how you kill people.
Yeah. Yeah. I mean, I'm glad you put it that way because I think like a lot of times we just see the immediate segment in business terms, right? The immediate segment that a product is affecting, and when it comes to, let's say, a lot of these medical AIs that are coming out, it's sounding like it's all right. Well, let's build something for the researcher, right? And it could be a very effective tool for the researcher, and it achieves that effect. However, it sounds like you're thinking, all right, well, why is the researcher there? Well, the researcher's there to provide guidance and maintain a bar standard for, we'll say, the pharmaceutical company or the surgeon or the doctor or whatever, because then that doctor is the one, or that pharmaceutical company is the one that's ultimately creating the product or doing the service for the patient. And I mean, again, I used to work in software, and there's this term called garbage in, garbage out, where if if you're putting sloppy code in, or as in the case of AI, if you're just pulling everything from the internet in without it really being vetted beforehand, you're not going to get any real useful output. And so it sounds like what you're doing is making sure that instead of just creating something that gobbles up a bunch of information and spits it out, which then puts quote unquote garbage into the pipeline for the researchers, which then goes to the doctors, which then go to the patient. You're saying, hey, I'm not letting garbage into the system. It stops with me. Is that?
That's perfect. Yeah. It's essentially what we have is a
Mm,
three-step process in that
okay.
sense, right? So we have an ETL tool, which means that it's able to take data, structure it, process it, and prepare it for the actual research assistant that we've
Mm-hmm.
developed, which is the core literature review network, the ability to read through literally tens of thousands of papers within the span of a couple hours and telling you what's relevant and what's not.
How long would that normally take to run through? Because like I've seen some of those papers before, tens of thousands of them. How long would that normally take?
It usually takes anywhere between, like, if you've got a big team of researchers, maybe like
Mhm.
5 months. But if we're talking like
Yeah.
a grad student, it's probably going to take them like 18 months.
Oh my
So
gosh.
it's,
Oh
yeah, and that's one of the pains of grad school. I'm
yeah.
so happy I don't have to deal with. So
You're a hero. You're a hero.
I literally, again, I literally saved myself towards
Yeah.
the end there because if it was not for the literature review network, I'd still be reading, honestly. So, um, but yeah, it's so the research assistant, that's the core product for doing
Mhm.
systematic literature reviews, which again, we want to operate within the confines of the existing medical apparatus. So there's industry standards such
Mhm.
as PRISMA. So PRISMA is preferred reporting items for systematic reviews and meta-analyses. So essentially, when you're going through and you're deciding what studies to include or exclude in your final analysis,
Mhm.
you've got to be very systematic about it. You have to
Yeah.
report specifically why you decided to exclude something.
Mhm.
A lot of AI don't do that. You go to these basically, again, ChatGPT API AI services and you ask them like a research question, like tell me about heart failure. Sure, again, it'll pull you up 20 studies, but it's not Prisma compliant. Like whatever output it's created, you wouldn't be able to publish that. So the research assistant that we've come up with is something that will actually produce publishable research. Um, and then the third and final agent that we've developed is our learn analyst. And this is the one that can do the next level, like bioinformatics, cheminformatics. We're talking about deep data science.
Yeah.
And this is the stuff that kind of like really calls back to what I did during my dissertation as far as, deep analyses type statistical methods go. But yeah, we want to make sure that anyone that's interfacing with an AI agent, they again understand why the algorithm made the decisions that's made it. And they also should know, at least very basically, what type of algorithms they're interfacing with.
Mm-hmm.
And so we've come up with this thing, we're calling it the AI package insert. Essentially, when you have your little pill bottle, you peel back and you see this massive label on it, the
Yeah.
drug label, that's a package insert. And so it'll tell
Okay.
you all the studies that went on. It'll tell you um, people that this drug is contraindicated for, who shouldn't take it. And so that's what we've come up with AI. And we're hoping that this initiative, this kind of thinking doesn't just play out in our space. We're hoping to kind of like by raising the bar up, setting a precedent for other companies to follow and other
Yeah.
research bodies to follow. And actually, it's kind of interesting because just a couple weeks ago, I saw on LinkedIn, there's one company that we talked to like 6 months ago.
Mm-hmm.
They've now started saying that explainability is important in an
Mm-hmm.
AI process. And so
Yeah.
I'm like, okay, yes, like we're winning.
We're changing
So
minds. We're changing
changing
minds.
minds. Yeah,
That's
man.
awesome. That's incredible. I mean, it sounds like I think one of the things I'd like to get into is you mentioned that this was a necessity that came out of your PhD to really comb through a bunch of the material that you had to go through, and then you started getting into, I think, post PhD is realizing like, wow, what this is capable of is going to affect patients. And I feel like there's like a deeper why here. Were you always very, as you were building this out and realizing that this could expand beyond you, was the idea of these end patients like that your driving force? I mean, obviously we want we want people to live unless you're a psychopath, right? But it's still like, again, as a product manager, like a patient seems like a very ambiguous, abstract idea segment. I even want to call it an avatar because it's still like, yeah, it's a patient, but I can't put a face to that person. I just know it's somebody who's having a hard time. Did you have anything that was like closer to heart as far as, and then that kind of translated into thinking about patients?
Well, pun intended, because it was related to the heart.
Oh yeah, that's
Uh,
right. Yeah, you did
yeah,
mention that.
but yeah, heart failure and heart disease is something that it runs rampant in my family.
Okay, yeah.
And when I was born, actually, my mom's dad, my grandpa or papa,
Mm-hmm.
he had a stroke
Mm-hmm.
a couple of days after I was born.
Mm-hmm.
And while he's fine now, thank God,
That's good. Okay, good.
it's just of course, seeing these people in my life who've been affected by different disease states, cardiovascular disease states, and just being concerned for them, right? That's something that pushed me into medicine to begin with.
Mm-hmm.
Sort of philosophically speaking, I wanted to be a journalist initially when I started
Yeah.
college, and and the reason for that, oh my goodness. So back in high school, back before it became garbage, I used to watch Vice all the time, Vice Media, and I was a big fan of the
Yeah.
the sort of independent journalists that would go
Yeah.
out and tell these stories, like the Ukraine war back in 2011 or so, when that not version, but that like instance of the Ukraine war had
Yep.
started,
Yeah.
there were vice journalists out there on the field, on the ground, literally in the trenches with Ukrainians reporting on the
Mm.
scene. And
Yeah.
so I thought that was brave, and I thought that was important because they were elevating people's voices who otherwise might not have had a
Yeah.
chance to
Yeah.
speak. And so that's how I felt, and that's what I did when I went into college initially, is that I wanted to
Mm-hmm.
be a journalist to elevate people's voices.
Mm-hmm.
But then a couple of things happened. Number one, I realized I was an introvert, and it was kind of hard for me to talk on stage or in front of the camera. So this
Yeah.
this is this is big for me right now.
You're
Um,
doing great, man. I'm an introvert too, so like we're just a couple of like we're trying really hard not to hide in the corner from each other right now. So
yeah, as I'm slowly slinking more away.
fooled all you
Um,
guys listen, yeah.
but that was one thing. But
Yeah.
then the second thing, which is a bit more dismal, the second thing is that I had a couple of friends and family pass away from some
Mm,
chronic diseases, and that was kind of like the eye-opening moment where I realized, okay, well, maybe I could help people have a voice, but
mm,
if they aren't even capable of speaking, if something outside of their control is it's physically limiting them,
mm,
then what could I do to help them overcome that limitation so that they
mm,
can have more freedom and more ability
yeah.
to live a fulfilling and empowered life?
Mm,
So, uh, thematically, that has been kind of like my driving purpose
mm,
throughout my entire academic and post-academic like careers, is that I have wanted to give people the ability and power to improve their physical well-being, whether that's through healthcare or in a sort of sociological, like economic sense, journalism. Like that's
mm,
been my drive. And
mm,
so just recently, um, people had come to me and asked me whether or not I could use Learn to look up specific conditions that they were struggling with at the time.
yeah.
Actual like my mother came to me and asked me a question if I could look something up for my grandma. So it's like instead of going to Google where or even Google Scholar where she would
Yeah.
look up things and get information in a very unstructured way, and she would probably have to have like a level or a license in order to actually see it, synthesize and
Yep.
understand it.
Mm-hmm.
She went to me and asked me if I could use Learn to, create a quick learn model, go through the literature and find like 20 key insights to help my
The,
grandma. And
well,
so,
the other thing too that I think is interesting about that, and I'm not sure if this is something that you and your grandma ran into, but I can imagine like everybody, and I'm sure for people listening right now, we have all felt like off, and then Googled our symptoms, and then Google's like, oh, you have this rare disease that is you're not going to live from it, and they're just like, oh my gosh, crap, Um, and I think the reason is right is ultimately it's like everybody's got a CYA, right, cover your ass. So everybody's gonna be like, hey, we're gonna let you know what the worst possible thing is, even though it's probably not that. Just because if we're like it's nothing, then you could come back and sue us or whatever, right? Um, but obviously it doesn't really help anybody. It's just it kind of seems like an uncourteous courtesy, you know. And so getting back to your grandma, I'm not sure she ran into that, like maybe trying to Google stuff on her own and being like yeah, you don't want to ignore it, but is this really as bad as what's being made out to be? And then coming to you and then saying like, hey, here's actually a very specific and plausible definition of what you're going through that that may not be as bad as what Google or WebMD is telling you that it is.
when they came to me with the question and I was able to give them the results of that
Mm-hmm.
question, like that definitely gave her more, it made her feel more calm in the
Yeah,
situation, right?
yeah.
And part of that story too that's important is they printed those results out and they gave them to a doctor. So
Mm,
even though the doctor didn't do anything with that in terms of like research or a publishable study, at the very least, he was able to take it, and he was actually able to understand kind of like what my grandma had seen, so then
Yeah.
he could better contextualize it for her.
Hmm.
So contextualization, like that's one of the key parts to all of this, is having
Hmm.
a human, having an expert, I would say too, an expert involved in process, in the loop.
Yep.
And it's another thing that a lot of these companies don't do. They just have a bunch of engineers, people who are really good at programming and math, and they build some really cool platforms. But then when you are feeding it on data that's not being structured or reviewed in a sense by an expert, then you start to have problems.
Yeah.
And so that's so yeah, basically by scrapping the whole WebMD stuff that she saw and getting this little snippet that I wrote for her and giving it to the doctor, it both helped her feel more confident about her condition, and it also helped give the doctor some context on how he could communicate it to her. So
Hmm.
there was a pretty interesting like little um, interaction that happened there, and
Yeah.
I was happy that at the very least, again, my algorithm wasn't producing some outrageous answer telling her to, drink some chemical concoction from her cabinet or sink or something, right? Like
Yeah.
that's what
Well,
these
I mean,
non-explainable AI will do.
so I mean, I think this kind of goes into a broader question is, and I think we've touched on it in different ways, but obviously there's a lot of ways that Ziplitics or a company or even a person's, I'll call it passion of necessity, turn business can be defined as successful, whether it's monetarily or people that they've saved by volume or just people that are close to them. With everything that you've gone through so far with Ziplitics, what would you say is that paradigm moment of success for you?
My biggest like personal success from this was when a global medical director came to me and he said to me, Josh, I'm curious, can you replicate a literature review that we just did? And so he gave me a set of inclusion exclusion criteria,
Mm-hmm.
and that's all I had. Basically, just kind of like, here are the initial parameters that we're looking for.
And real quick, is that kind of like that Prisma stuff, the inclusion exclusion that you were talking about, or is that something different?
Search strategy is related to Prisma,
Okay.
right?
Okay.
So
Cool.
so so it's connected in that sense because
Gotcha.
it's you're defining the scope of the
Yep.
stuff that you're going to look at initially,
Mm-hmm.
and so and then how you're going to go through and eliminate it, right?
Gotcha. Okay.
So the that's all I had at first, and they
Yep.
were also very broad, and
Mm-hmm.
so I had gotten COVID, and so I was like, well, this was over last Christmas break,
Yeah.
so I wasn't able to go and see family and friends. I had to keep to myself in my room, and so I said, well, I might as well just do the study while I have COVID.
Mm-hmm.
And so we did the study, produced a learn model. After a couple of
Mm-hmm.
iterations, I've spent less than 4 hours doing it all. Gave him the results, and to see the look on his face, and this man rarely curses, right? Like he rarely curses, but
You
he
made a
said,
good man curse.
he,
Congratulations.
yeah, yeah, I know. Maybe I shouldn't be proud of that, but um,
I'd be proud of that. That's sweet.
but so he said two explicatives, and it was at that point I realized, oh, this might actually be something. And then he introduced it to some really high, like chief C-suite people at his organization, and
Yeah.
they said, okay, so their only questions were, what's your business model? And I was like, oh my God, I haven't even incorporated yet. What do I like? So
Oh, so this is
um,
pre-Ziplitics. This is like you didn't even like. So this wasn't Ziplitics. This was like before Ziplitics. This is like the thing that maybe had you turn it into a business, or
like
did I miss the mark on that?
yeah, it's kind of like it's like I had graduated, and I think like maybe a couple months out, I was just kind of figuring things out.
Yeah.
I was trying to become a machine learning engineer, And which, by the way, for people listening, if you're in this space or you want to get into this space, do not call yourself an AI engineer, okay?
Mm,
Just because people that are actually in the space, if they hear you say AI engineer and you don't have this already strong record, whether that's publications or um, job history, people are just
yeah,
going to look at you and think like, oh, he's just a script kiddie that plays with Chat GPT all day, right?
yeah, yeah,
So machine learning engineer is what you should be going for. But
yeah.
anyway, so I was just an ML engineer or trying to be one at the time, and that's when I got this introduction, and they were like, hey, this actually we want this, and so yeah, I guess corporation technically wasn't formed at
Mm.
that point, but
But that's
at
like you're
least
like, I got something now. Like this is business ready.
yeah,
Yeah,
yeah. I was like,
that's
okay, well now
insane.
I need to make something, like need to actually create a legal entity.
So
I can't.
how long would it have taken him, like for him to make his what was the thing that you replicated the technical term?
Systematic literature review.
The systematic literature review. How long do you think it took him to write that initially? Because you said it took you 4 hours. It took him how long do you think?
So it was actually him plus like 8 other people,
Okay.
and it took them 11 months. So I
Wow.
you know yeah.
That's insane.
Yeah, it's now the thing is though, the thing is, it's just a caveat. Like I'm not an expert in his field by a long shot.
Yeah.
And so the final output when it was generated by Learn, it was 91.51% similar, which means that
Mm.
there was 9% of the content that was dissimilar from their final review.
Yeah.
So the point I'm trying to emphasize again is that we should keep subject matter experts in the loop, right?
Mm.
Like when we're training these algorithms and when we're using them in practice, whether that's clinical practice or in research, the experts should still be there. They should still
Mm.
be involved. In what
Mm-hmm.
capacity? That could be, defined later down the road, either by regulation or just by
Yeah.
industry, like practice, industry standard. But the experts are those that are going to like I replicated the systematic literature review.
Mm-hmm.
If I had done that from scratch, I wouldn't have been able to define those initial inclusion exclusion criteria
Yeah.
because I wouldn't be an expert in
Yeah.
that area.
Yeah.
So, it's important to note that the experts will be the ones asking the questions. And the way I see the future of AI is that in the future of research, rather broadly speaking, is that a lot of the hands-on manual stuff that
Mm.
we've had to do for hundreds of years, that's going to be automated.
Yeah.
So, you won't have to go into a lab and mix your reagents to prepare, your, let's say, mass spec to do a run and,
Mm-hmm.
and collect some data. There could be robots or at least semi-automatic system that does that for you. Maybe you
Yeah.
just go in and load in the chemicals and the rest is taken care of for you. And in the sense of learn, in the sense of this evidence-based research that we're doing, you're not going to have to spend hours and hours reading papers, going through the results, writing papers themselves, like writing up the evidence summaries. Instead, you're going to just ask questions, but they need to be very specific and very informed questions. But you're going to ask the right questions, you're going to get results, and then you're going to help guide the algorithm to the right results.
Mm.
And only experts can do that.
Well, that's good. That's not garbage in, right? That's we'll call it kale in, kale out.
Yeah, yeah. Spinach, maybe even. Yeah, yeah. Something
Spinach in,
that's,
spinach out.
yeah. Good old
Subject,
subject matter expert. Yeah, spinach
yeah,
matter expert.
spinach
There you
matter
go.
experts, yeah. Well, I mean that's it's interesting too because and I'm not going to name names not because I don't want to name names but because like it'd be too long for me to name names. There's a lot of tech companies out there that initially claim that AI's here to help. I don't want to use the word synergize. Ugh.
Go ahead,
but
use the corporate lingo. Do it.
but synergize with the workers, right? It's not here to replace you. It's here to help you get the repetitive stuff done. And then 9 months, 12 months later, they reduce their workforce, and because they think it can be replaced with AI. And I think that's a shame because for the exact reason that you said, if the right questions aren't being asked and the right answers can't come out, uh, and what I think is brilliant about this too is I see a very similar phenomenon of the mechanics of that across every industry that I've worked in. And to give you two examples, like we'll take we'll take we'll take coaching. um, one of the key tenets of like being at least with the business coaches I've worked with, is they're not there to tell you the answer. They're there to ask you the questions so that way you can figure out the answer yourself. That way you get to own it. But it all starts with, hey, like, I know what it's like to build a business. Let me start asking you questions, not necessarily to lead you to where I want you to go, but because there's holes that you're just not going to know. And by me asking this question, you're going to come up with a better solution that may not be the same thing I did, but it's going to cover your unique business hole, right? And from there, you're going to be more likely to be successful. And then another industry is in the arts. So again, like I come from an art background, like doing concept art, and one of the things that we used to do, because when it comes to perspective, right? If you're drawing an environment, perspective is really how things vanish into the distance. It's what gives a piece a sense of realistic space, and there's actually mathematical ways to create perspective on paper. Now they take a long time to do. You could do it completely by hand, and if you want to be super accurate, you can drill down the angles of everything, like every object you're going to put into that perspective down to a T. It can be like very formulaic if you want it to be that level. But a lot of times what we'll do is we'll go on the internet or we'll take a picture of something that has a similar environmental layout, and we'll put that into Photoshop and we'll draw on top of that like all the guidelines, so like use it as the
Crazy.
scaffolding, and then we'll draw the ideas on top of it. So you never know the picture underneath is completely hidden, but it's used as the framework for the imagination of the artist to then build everything on top. And it sounds like it's the same thing. Like, yeah, it'll get me 90% of the way there, but the human element, that last 9-10%, that's what gives it that novelty that's going to start pushing the boundary forward or start expanding the boundaries of what we're trying to do. So yeah, I just thought that's interesting, like hearing that from an AI perspective.
I think what you're hitting on is the idea that when it comes to the actual ability to generate new knowledge, like it's up to the
Yeah,
human. It's up to the
yeah,
human to do
yeah,
that. And
yeah.
that's something I also fundamentally agree with. Um, to use an example, if you think of knowledge as everything being contained within this bubble, all AI can do really is find novel ways to connect things that already exist within that bubble. It
Mm-hmm.
could lead to, a new perspective in a sense of looking at something.
Mm-hmm.
But in order to determine whether or not that's actually a new perspective or not, you need to have a human for that. There's this
Mm-hmm.
this school of thought in our field that think, okay, we can use AI to actually reinforce and train AI. And what happens with that, one of the problems with that is when you take AI generated content, feed it back into another AI's training set, meaning the information that is kind of like learning initial concepts or relationships from, over time, let's say that the model that generated that content initially is 80% accurate. Well, that means that 20% of the time it's wrong. So you feed that into another model, it's going to think that everything it's being fed is the truth initially, that
Mm.
all those labels the other algorithm came up with, they're the real deal, when actually 20% of them are wrong. And so if you do this enough times, within a couple of generations of doing this, it's just straight up hallucinating, meaning it's just straight up like coming up with nonsense that has
Yeah.
no grounding in reality whatsoever. And so there's a lot of people that are struggling in this area to try to solve that problem to where you can have AI train AI. However, I think the fundamental issue is that when it comes to learning something about the world, if you don't have a system that's capable of thinking of its own thinking like we are, sapient entities, then you're not actually going to discover something new.
Mm.
You're just going to make connections between things that already exist. And again, maybe another system that also can make really good connections will look at those connections and give it like a quantitative metric, be like, oh, that's 70% accurate. But what does that even mean? Like, what's the relevance of that, right? It's
Yeah.
AI is a tool. It's
Yeah.
a tool, and tools should serve the inventors. It should serve us. So if the tool is just running autonomously and it's just making noise, then why did that company get $1 billion in investment, right? Like what's the point?
Do you
So
do you think investors know this? Like, I mean, that's an interesting point that you bring up because, and this may be a very, I feel like it's going to be a safe opinion with you. Is probably going to be a pretty unpopular opinion in general. Um, I feel like what's happening with AI is very similar to what's happening or what happened with like the dot-com bubble, where you have
yeah,
a bunch of like it's a new technology and it's awesome. I mean, the potential is insane, um, as you've described. But I think for people who aren't experts in it and can't really discern. What's real and what's a unicorn in a bad sense, right? Um, it's very easy to say like, "Hey, this is AI," and again, like nobody really questions the real utility of it because it is so new right now. We haven't fully gotten there yet. So anyway, uh, do you think? Do you think investors are aware of this as there's so much money being poured into all sorts of AI startups?
can't speak for all investors, obviously, but the ones I've talked to, the analogy you use for the dot-com bubble is exactly like what they've said, right?
Really?
Like they're yeah,
I'll pat myself on the back for that one.
yeah, they're skeptical too, right?
Yeah.
And I mean, I understand that like in 2020, there was the whole kind of like AI explosion where there's just a
Mhm.
lot of money coming out and people were um, getting really excited for it. But I think what they've started to realize as they've had more technical conversations with the companies they've invested in is okay, well, there are limits,
Mhm.
clearly. And I think the problem is that when you have a room full of very smart engineers, uh, with again established records like great publication history or record, great track record as far as your career goes with big companies, you know, having that plus metrics in the form of tens of thousands of users or what have you. It's like that information can start to dilute the conversation
Yeah.
and it can kind of start to distract people from the truth, which is simply that if they're using a model that's not explainable and they don't know how they're getting their data, they don't know what the model does with their data, or
Mhm.
before even the model gets the data, what's happening to the data. Like if there isn't some explanation of that, then it's possible that these companies might be almost kind of hoodwinking the investors,
Mhm.
and having them forget about the possibility of what's called model collapse. So the situation I described before, where
Mhm.
AI generated content is then fed into a generative AI that generates more content,
Yeah.
that is something that we're already starting to see. So
Yeah.
it's literally like the quality of GPTs, the quality of ChatGPT models has just it's starting to plummet. It's becoming unstable, and this is I'm sure they'll come up with something. The versioning that they're doing right now is already like good enough, so they'll probably come up with something to protect their assets.
Yeah.
But there are other companies that um, maybe aren't aware of this, which there are a lot. Like they're
Yeah.
going to suffer as a result. And again, within the context of I don't know cooking, like you said, like a food AI
Yeah.
website, that's I mean, who really is going to get hurt from that? Maybe like people that are on keto diet, but like if you're like in a
Or if,
healthcare setting
yeah.
and it's doing it, then that's a problem.
Well, I was gonna say if it just keeps feeding from the entire internet and you keep feeding it over and over again, eventually it's gonna tell me to add bleach into like my saute, which is probably not good.
Yeah, yeah, it probably shouldn't do that. Probably shouldn't.
Sauteed
Yeah,
bleach, yum.
sauteed bleach.
Yeah.
Yeah,
um,
it's
Man, I know there's. I'll be honest. I think we should do another one of these because there's. I feel like we're just getting started, but I do want to be respectful of your time, and so there's like one more question I want to ask, and then there's a couple things I think that you're working on, some pretty big news that you want to share that I want to make sure we have time for. But before that, I'd like to ask you if you had a piece of advice for somebody who's thinking about following their passion. Um, I guess what would you give them? What's something that has helped you stick with this through the good times and the bad?
definitely having a passion, like having a purpose, right?
Mm-hmm.
Like my family and my friends, and seeing what they went through has been reason enough for me to keep going.
Yeah.
And I think that it's important to realize that there's a lot of things that are going to happen in your life that you're not going to even be able to possibly have accounted for, right?
Mm-hmm.
Um, I could not have foreseen COVID just completely taking out all the progress that I would have made in an
Yeah.
analytical PhD.
Mm-hmm.
And yet here it came, this global pandemic that forced me to make a lot of significant life changes. And even then, I still had a loci, I still had a point of focus that I was running to. And I told myself that, no matter what, you're going to get there. It's actually interesting. It's kind of like a meditative exercise, talking to yourself as you instead of saying, like you can do this, Josh. That's actually
That's
something
interesting.
that has kind of helped me to
Yeah.
stay a little bit more in on purpose and in my track.
Yeah.
So what I'm trying to say is essentially if you trust the process, and this is something that one of my colleagues used to tell me all the time, is just to trust the process and you run towards that point,
Yeah.
you will probably get there. And your gut will tell you too whether or not you're doing the right thing.
Yeah.
So you know, if my gut was to tell me this AI ML stuff, Josh, you shouldn't really do this. I would have felt that probably very early on,
Mm.
but haven't felt that yet. And I've been running towards this point. And because of that, we have had some really cool things happen recently.
That's
So
awesome. A scientist in touch with intuition is a very, very powerful combination. That's your inner artist, and I'm sitting here like with my hippie hair, man. Um, but that's
it
awesome.
rocks too, by the way. Your hair rocks.
Thank you. I appreciate it.
Clearly, you did not go to grad school. Otherwise, you wouldn't have that
Yeah,
amazing
it'd
hair.
be gone. Well, maybe I would, but I'd just kind of like have it in the back, and like everything else up top would be gone.
Keep your hair,
Um,
man. Keep
yeah.
your hair.
Thank you. I plan on it as long as I can. A side note, I did like one of those 23andMe's, and it turns out like they have if you were like what certain genes you have, and they're like you don't have the balding gene. I'm like holy shit! Did I roll the freaking dice on that one, man?
Oh,
Um,
man.
So I'll talk to my dad. He's like, just wait till it goes away. I'm like, sorry, Dad. Got my mom's genes on this one.
Lucky. Make him pissed. Yeah.
Oy vey. Well, on that note, you mentioned you've been doing uh, a couple of cool things. Some new things have come out of Ziplitics. What's some big news that you want to share?
First thing is that we are working with professors to
Hmm.
teach explainable AI courses.
That's
So
awesome.
within the past couple of weeks, I've been teaching at Concordia University, Wisconsin,
Nice.
and it looks like we're going to have two more universities lined up for the beginning of next year already. But
Dang.
we've started actually like getting into classrooms, and not only are students, of course, getting educated on the importance of explainable AI and reliable and responsible AI, but they're getting hands-on experience. So they're getting
Hmm.
to use, learn to do their own research, which will be publishable because it's Prisma compliant. And so that has been really exciting for us. We've also, so a month ago, we released our benchmark seminal work that
Hmm.
was this replicated systematic literature review.
Hmm.
Uh, we've got some things cooking that will be coming up pretty soon, and we're
Okay.
very excited for that. But it's
Awesome.
based off of those initial findings that we've been able to do within
Hmm.
that SLR, as well as another SLR that will be coming out soon. But essentially, we're at the forefront of research with
Yeah.
AI, not just explainable AI, but with AI, especially in the health sciences. And what we had completed about a year ago will be published relatively soon. And that thing is a medical consensus statement, which essentially is one step below a clinical guideline. It's kind of like if you go to the doctor
Hmm.
and they're trying to stay on top of what's happening in their field. They're going to look at guidelines and they're going to look at medical consensus statements.
Hmm.
So we have essentially what is the first ever AI led medical consensus statement. And this is to say that we've been able to take a process, again, that could take not just a year, but many years. And we've been able to condense it down into the span of a couple hours. So
That's
we're very
insane.
excited to release that soon. It's being peer reviewed right now. So once that's published, definitely can share that with you. And I definitely would love to have another convo, not just to
Yeah.
talk about this stuff, but to dive deeper into the philosophy of this all, right? Because
Yeah.
AI is very old. People think that it just came out recently. Conceptually speaking and philosophically speaking, AI has been around since the ancient Greeks with the whole idea of the automaton. So
That's
it's a pretty old idea, and I think there's a lot of cool kernels of truth about humanity too buried in AI
oh man.
that I would love to dive deeper in with you. So
I'm a humanities guy. Like I'm already excited about this. Like yeah, we're gonna get another one on the books. Y'all stay tuned. It's happening. I'm like literally after this, I'll send you the link and we'll get it going.
yeah,
um, cool. Well, before we wrap up, anything that you want to shout out? I know you'd mentioned, people can find you at https ziplitics.co, not com, right?
Ziplitics.co. Yep,
So
sorry.
okay, sorry, you're good. I'm reading it off of this for the sheet right now, so I'm currently not making eye contact because well, I have the memory of a goldfish, and I gotta read these things in real
Yeah,
time.
no, you don't. Come on, man.
um, so they can find you at ziplitics.co. So that's ziplitics.co. They can find you on LinkedIn at linkedin.com/in/Joshua Morris. That's JOSHUA-MORRISS. So that's two R's, two S's. And then it also looks like you have some on ResearchGate. Is ResearchGate for the non-researchers out there? Is that like where
Kind
those
of like
papers?
Yeah, it's kind of like the Twitter of research. I mean,
Okay.
I feel like ResearchGate would be pissed if they heard me say that, but 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 yeah,
Listen,
it's yeah.
listen, ResearchGate. If anybody from ResearchGate is listening to this now, take a chill pill. Hopefully, whoever researched the ingredients that went into that chill pill did so with explainable AI or subject matter expert. If they didn't, stay far, far away. um, but they can find you at researchgate.net/profile/Joshua Morris. And then, as far as like programs or launches or anything that you want to offer, you mentioned on here that you're doing research services for medical directors, and you also mentioned the educational services as well. Is there anything else that you want to run through with anything that Ziplitics is doing for people who may be interested in inquiring about more about what you're doing?
Sure. So we're working with like C-suite level executives as well as like global medical directors. So essentially helping entire departments or teams within those departments do research. So we're doing systematic literature reviews, meta-analyses. That's kind of like our bread and butter, but we also do scoping reviews. We do experimental method development. So if you're a lab team and you need help coming up with some analytical chemistry method,
Mm.
we can help you with that as well. And yeah, I mean, we're open to pharmaceutical companies, medical device companies, university, hospital systems, and of course, if you're just interested in this and you want to talk about explainable AI, I'm always open to that too. I love geeking out on this stuff.
That's
Um,
awesome.
but yeah, we're working with professors, helping them do research, helping them and their students get papers. So if any of that interests anyone listening, feel free to hit us up. We'd love to talk.
And would it be best for them to reach out to you at the ziplitics.co, or to just reach you directly at LinkedIn, or
Either or. If you go to ziplitics.co, you'll see a contact form. But if you want
awesome.
to just talk to me directly, you can find me on LinkedIn, shoot me a message, and I'll get back to you there.
Cool, awesome. I'll make sure to put that in for like contact information on the show notes. So for anybody listening, I'll make sure to have everything on there, and Josh would love to talk to you. So with that, thank you, Josh. Thanks for being on the show, the first show ever. Dr. Josh Morris, CEO of Ziplitics, doing amazing things, explainable AI, changing the way that we're bringing new pharmaceuticals, new medical services to the market, and ultimately making sure that only quality comes out. So that way, at the end of the day, it's the patients are going to be okay. So thank you, Josh. I appreciate it.
Xander is great. Love talking to you. And
Likewise.
I would say this was a not so oddly successful episode. So I really enjoyed it.
I appreciate it, man. Thank you. So with
Appreciate you.
that, so thank you, and thank you everybody for listening to this episode of Oddly Successful. If you enjoyed this show, please consider leaving us a review. Doing so allows us to reach more people, and if more people hear more stories of others like Dr. Josh Morris here, who found success beyond the traditional track again through necessity, and then really thinking about those close to him and how that would affect the greater world. I believe that is also going to give everyone more courage to strike out and do what they were put on this earth to do. So again, a review helps immensely for that, and we greatly appreciate it. So thank you again for listening, and until next time, stay weird, folks.